Which one is your wisdom teeth?
The wisdom teeth are also called the third molars. The reason we call them the third molars, if you think about it, you have teeth in the front, we call those incisors. We have the middle-sized teeth, we call them the premolars. Then we have molars. There are normally 3 of them: the first molar, the second molar, and the third molar. So the third molar is the last tooth in your mouth if it has come out, and you'll find it on the upper left, upper right, lower left. So you normally have 4 of them. There are some people who are missing 1 or 2, but for the most part, most people have them.
They only bother me every few months.
I find that people within the age range of about 18 to 21 will often complain about their wisdom teeth, and they'll say every couple months they'll feel lots of pressure, sometimes pain, and then it'll go away. Sometimes you even see swelling in their mouth and see like a little peak of a little white thing coming out of their gums. The reason is during those ages, and sometimes that's as young as 14, sometimes as old as 25, it's different for everyone. During that time, as the wisdom teeth are starting to push their way up, they'll periodically give you a little pain and then stop, and then they'll kind of grow a little bit and then stop. So that's usually the most typical thing. Now remember, while they're making that push, you want to get them out, because if they're trying to come out and they can't come out, you want to avoid some of the issues that come with a wisdom tooth that can't make its complete way out.
They're not bothering me. Why should I take them out?
One of the main reasons that we take wisdom teeth out at every age is because the wisdom teeth are so far back in the mouth, they don't get brushed as well. Even people who do not have impacted wisdom teeth, and their wisdom teeth, fortunately for them, came straight up and down, those people get more cavities on those wisdom teeth. So if you can imagine, most people, they brush their front teeth pretty nicely, they brush their back teeth okay, but imagine that wisdom tooth is all the way in the back, sometimes gone out to the side towards your cheek, sometimes half under gum, half not under gum. If it's not getting cleaned properly, then you're going to get a cavity. I like to say in my office a lot, if you can keep them clean, you can keep them. But even people with the best hygiene, those wisdom teeth get cavities. So why risk having all the problems that come up with the wisdom teeth? I mean, I've taken wisdom teeth out in 60-year-olds. It's not very much fun. So if you can have that out early, you can avoid a lot of the issues that people have by having wisdom teeth.
Is it painful? And how long do I get to take off of work or school?
Now, as far as pain is concerned and wisdom teeth, there's 2 factors that we have to talk about. The first factor is during the extraction. So if you're having your wisdom teeth taken out, absolutely, we have to get you numb, because no one's going to pull your wisdom teeth with you feeling something that would be very uncomfortable for you and very uncomfortable for me. So we numb your mouth so you don't feel anything. Most people just feel pressure. I won't say it's the most comfortable thing in the world, but pain is not involved. The thing that I hear the most often when I'm doing a wisdom tooth or after I've done wisdom teeth extractions is people say, "Oh, I think that was so much better than I thought it was going to be." You just feel pressure. I will talk you through it. You'll be just fine. Now, as far as after is concerned, I definitely give you pain medication, in some cases antibiotics if you had an infection, or if I think you might get one. But for the most part, I caution you to not make any plans after. I have people, they have their wisdom teeth taken out on Friday, they're at their movies on Saturday, and I have some people that they feel a lot more lousy. I feel like most people's discomfort comes from the fact that they're taking pain medication that makes them sleepy and groggy, and rest is the best medicine. No matter what we give you, taking time just to relax, watch a movie at home, be easy until Monday morning. Usually you'll be just fine. There's usually that great period of a week, and maybe you felt a little sore and that sort of thing, but for the most part, usually within a week you feel pretty good. Of course, if your teeth are impacted, it might feel a little bit more painful on 1 or 2 of them, but having them out is well worth that short period of discomfort. Are you sure you weren't still in the other video?
Will my cheeks blow up like a chipmunk?
I get that question a lot. People always ask if they had a friend and they had their wisdom teeth taken out and their whole cheeks blew up like a chipmunk. Most of the time that doesn't happen. That is just, I'm not sure why that happens. Actually, I am sure why that happens. If you have a person who's pulling your wisdom teeth very aggressively, it's going to cause more trauma, and most likely you're going to get more swelling. Most of the swelling is due to just the liquid building up in your mouth. I would say I do a lot of wisdom teeth, and I would say about 90% of my patients do not have swelling, probably a little higher than that. But for the most part, we can treat that with antibiotics. We can treat that with anti-inflammatory medications like Motrin, just to kind of reduce the chances of swelling. But most of the time, your cheeks are not going to blow up like a chipmunk.
What is an impaction?
When we're talking about wisdom teeth and impacted wisdom teeth or an impaction, that just means the tooth is stuck. Sometimes a tooth can be stuck in the gum, and if you look in your mouth, you kind of see half the tooth with gum sitting over top of it. Sometimes the tooth is stuck in the bone, which means that the tooth is trying to come out, but the bone, especially in the jaw and the bottom, kind of covers half of the tooth, and it keeps the tooth from coming out completely. Sometimes the tooth is stuck against the tooth that's next to it. So a lot of times on the bottom, if you think about it, on the bottom, this is the tooth in front, and then the wisdom tooth is trying to come out, but it's stuck up against the tooth next to it. We have horizontal impactions, means that wisdom tooth is laying down sideways. Sometimes it's a little slanted like this. So impaction just means the tooth is stuck and it can't come out, and that's especially why we need to take it out.
Will I be able to eat afterwards, and do I need antibiotics?
Now, most people, I want you to eat after you have your teeth extracted, especially when you have pain medication and you're already feeling kind of yucky. You want to eat something. When we tell you not to eat, it's because when you're numb, it's very difficult to feel your lips, your tongue, your cheek. So we don't want you to accidentally bite your tongue and hurt yourself. But we want you to eat. That means a smoothie or something soft, something that doesn't require a lot of chewing. You want to coat your stomach so that when you take your medication, it doesn't make you feel nauseous. You want to eat. You want to get your strength. You want to allow your body all the nourishment in order for you to heal quickly. Now, as far as antibiotics concerned, antibiotics mostly have to do with infection or preventing infection. If it's a difficult extraction, I will make the judgment and I will let you know, hey, I think you need an antibiotic. Or sometimes if you came in and you were already swollen, we want to resolve that infection. Most things, includes every dental emergency, most procedures, if you had infection to begin with, antibiotic is not taking care of the infection. What we do is taking care of the infection. So once that tooth is extracted, already the source of the problem is gone, and your body has antibodies and it's going to take care of it. If your body needs a little extra help to make that go faster, that's when we give antibiotics.
Do I have to get put to sleep?
Most people assume when they have their wisdom teeth taken out that they need to be put to sleep. Now, let's make a clarification about anesthesia. People use putting to sleep and anesthesia all in different kinds of ways. So I always have to clarify. When you have your wisdom teeth taken out, we have to numb you. We call that local anesthesia. That means that your mouth will be numb. You will be fully aware of what's going on. We manage your anxieties with talking, with music, with, just making sure that you're okay, with listening to you on how you feel during the appointment. That takes away pain. Then we can take it a step up. If you're really nervous, sometimes we can give you muscle relaxants and other anti-anxiety medications before the visit, but that's for your mind. That's not for your mouth. You still need to be numb in your mouth, but just to kind of take the edge off. We sometimes give you medications before the appointment just to relax you. Sometimes we can do laughing gas. Laughing gas is really wonderful because you breathe it in through your nose, and as soon as you breathe it out and you leave the office, it's gone. So that's the end of that. The other way that sometimes they'll do in certain offices is IV sedation. IV sedation is a little different. They put an IV in your arm and put you to sleep so that you cannot know anything that's going on. No matter what choice of anesthesia that we choose or anti-anxiety we choose, you're going to get numb in your mouth. So all of those things are to manage anxiety, but we need to make sure that you don't feel pain in your mouth while we're taking out the teeth.